Hi, Dr. Worley. This is Anna.
I'm Steph.
And for our third clinical rotation, we went to GE in Stanford. One of the practical skills, or many of the practical skills we performed, was taking blood pressure on each other, as well as heart rate at rest and heart rate during exercise. We performed sit-up tests, push-up tests, sit and reach tests, as well as waist and hip measurements. And we performed the YMCA bike test, as well as the Rockport walk test. So under educational information, we learned about the YMCA bike test in EX 362, testing and prescription. We first were taught about it in lecture, just about like submaximal exercise testing, and then we also performed this in the lab setting as well. And we were tested on it during our lab practical, so we performed 3 stages of the YMCA bike test in EX 362.
During clinical, we actually performed 4 stages of the test. So we had a bike that was a little bit different than what we had in lab. Instead of using the actual KPs, it was just a knob with different resistance. But we performed the 4 stages on each other. We performed this in clinical, and we used a computer fitness program that evaluated like our performance, and we entered all of our data that we had. And we were able to observe corporate members working out in the gym, and the main exercise test that we focused on during our rotation was the YMCA bike test, because that took up a big chunk of our day that time. So during the YMCA bike test protocol, as resistance increases, RPE, heart rate, and blood pressure all increase for each stage. Throughout the 3-minute stage, the client should reach steady state. From the beginning of the stage to the end of the stage, their beats per minute should be within about 5 beats. And that we experienced on each other. And we found an article that supports that information. We found an article called Exercise Intensity and Perceived Exertion in Adolescent Boys. So this article discusses, essentially, the test was done on boys aged 15 to 17. And I believe they did 3 stages at 30%, 60%, and 90% of their VO2 max, and they found that heart rate, blood pressure, and RPE are correlated to each other as they all increase together. And one thing that we found interesting about this article was that it stated that upon an RPE at 13 and 17, it's a good representation of heart rate between 130 and 170 beats, and also a close relationship of heart rate, RPE, and percent VO2 was observed, saying that RPE between 12 and 14 is a good representation of VO2 max between 60 and 80%.